Hello, I'm Elena Moro. I'm a professor of neurology at the Grenoble Alpes University, Grenoble, France. And I'm interviewing Professor Alberto Albanese, who is a professor of neurology at the Humanitas University in Milan, Italy. So it's a great pleasure for me because he has been my supervisor and mentor years ago when I used to work in Italy. And I remind everybody that we are here enjoying the 2023 International Movement Disorder Congress in Copenhagen. So, Professor Albanese, Alberto, we have, I think, a nice time together today. And I think a lot of people are quite interested in understanding why you have been so famous, you are achieving so many things during your career. So tell us a little more about yourself. So for example, what's about your early years, your education? Tell us a bit more.
Elena, as you know, I was born in the south of Italy. And I went to Rome to the university where we met also in the Gemelli Hospital. And I didn't want to be a doctor. My father forced me to become a doctor. So my question was, what shall I be as a medical student? And I found the field of neurology that was challenging, interesting. So I thought that this is very difficult, it's very challenging. So I tried, this field. So I became a neurologist. And particularly also the mentor, the local professor there was a fascinating person, Professor Macchi that you met also, and he loved anatomy, he loved the pyramidal tract, so he loved movement, and that was the start of the story.
That's fascinating, really, but you remember Professor Macchi was a multiple sclerosis guy. Why you got involved in movement disorder, especially in Parkinson's disease and dystonia?
Yeah, there was a team on anatomy, but I thought I could develop a little bit more the area of movement, and I went to London, and I was lucky to meet Professor Marsden, David Marsden there, with whom I worked, with him and with Peter Jenner. So I was working on pharmacology particularly and the clinical side. So there I became fascinated. My idea was that speaking to David Marsden was like putting two fingers in the power supply. It was a lot of energy coming out from him, probably too much because he didn't live long enough. He kind of burned out himself because he was so energetic, but he transmitted really that sense of novelty. This field was new. Very few people were working in this area. So it was all to discover. Anything was new. And we started the first treatments with botulinum toxin. I came back to Rome and got a special permission to import it. It was classified as a military weapon. So at the time, so I had a special personal permission to import it from the Ministry of Defense in the UK. So all of this was so fascinating, so new.
So you told us about Professor Marsden, Professor Jenner, so giant in the movement disorder history. And so tell us a bit more about your role models. Who was for you, besides maybe Professor Marsden, the person who touched you more, who inspired you more?
I think he was number one, of course. Then I had to, the possibility to meet and to become also friend of Stan Fan. Stan Fan became the mentor of one of my colleagues who was training with me. So she went to New York, and I had a long also interaction with Stan Fan, and they were so different. So meeting Stan Fan and David Marsden, knowing both of them, and it was interesting because I could see their different approaches. David had come from basic science and become a clinician through neurophysiology. Stan Fan was a true clinician, so there were two sides of the same coin. All of this was very challenging, very stimulating, and I cultivated these different aspects of movement disorders, all of them. I thought they were all interesting.
Excellent. So they inspire you. So you told us that you went back to Italy. So what, in your opinion, what are the major contributions that you would say I gave to the field?
So we started the field of movement disorder in Italy with very few other colleagues. We're all trained in that area. So we developed the grounds in the country. And just to tell you, it was, nobody knew much about this. So it was so an open field. I became interested in, of course, in Parkinson's disease, but also particularly in dystonia. My joke was that Parkinson's disease was my bread and butter and dystonia was my hobby. I thought dystonia was fascinating, absolutely fascinating and peculiar, difficult to understand, so very challenging. And dystonia was really the area where both Stan and David were really #1 in the world. And very few people understood what it was. So many people were asking consultations. So those who knew about hyperkinetic disorders, and particularly on dystonia, received a number of requests, for difficult cases, for second opinion, so on. And this was also very interesting because there were so many discussions and so many uncertainties. So I think I contributed to dystonia particularly, but also we developed also together with you DBS in Italy. We were among the first ones in Italy, and we did some pioneering publications also on DBS, also on the behavioral effects of DBS. We were first, before anybody else, to describe abnormalities of behavior, which later became impulse control disorders, but at that time this was not the terminology. And so, yeah, some innovation in all fields, but particularly dystonia was the peculiarity for us.
Which kind of challenges you had at that time? Because it was not easy, right, to come back and start this new field. Which kind of challenges you think they were really a great problem or difficult for you to solve, to deal with?
I think the challenging, different challenges, some cultural challenges. The neurology environment was not ready for hyperkinetic disorders. Many colleagues considered those psychogenic disorders, and this was a practical challenge. The first patients we got from the psychiatrist. So the first patients with dystonia were really followed by the psychiatrist. This was a challenge that we solved. Another challenge is I had to move around for a number of reasons. So I left everywhere. I changed four locations. And so everywhere I left some colleagues and I moved. So there were some blossoms which developed in these different places, but it was challenging to move around and to start all over again in different places. This was very challenging. This is in part is due to the complexity of the country and to specific reasons.
And do you think that these challenges, especially from maybe the scientific point of view in the field of dystonia, they are still there, or is much more improved and basically everything is solved?
Now it's all different. Now it's all different. This field is very mature, probably too mature, to the point that many people think they know. So the interesting part of the story now is to see too much self-confidence compared to the origins. I think now the challenge will be new therapies, to find new therapies in all different diseases. This is very challenging. At the same time, to understand the pathophysiology. So we have these two lines which I think will develop in the coming years.
So you think this is where we have to put our money. So the next step in the field, let's say within the next 10 years, to be more practical, will be this way to go?
Yes, I expect a lot of new treatments for Parkinson's disease and Parkinsonian conditions, and I expect great developments in surgical treatments, and also more understanding at the molecular and cellular level, which can in turn provide new treatments as well.
And so if you want to give 3 practical advices or suggestion to young neurologists and to young researcher in the field, which kind of advices would you give?
Today is still very important to know phenomenology as it was at the beginning. This has not changed. Phenomenology is more complex now, has changed over time, but the need for it has not changed. So these junior neurologists should really be good doctors, good practitioners, and at the same time they need to be knowledgeable, they need to know the mechanisms of diseases, and they can be open to developments for interventional neurology. I expect in the future that some neurologists will become interventional neurologists, so more active on the patients in practical terms, and treating directly with some more interventional approaches.
Thank you. And the other interesting question, even if as a woman I think that men are much better with that, how you can balance, right, your, let's say, private area. So how do you think you have been very good in balancing your private life and your job, or would you like to give some advice? What do you think about
Your
that?
slip of the tongue was interesting, because I think wife has to be very has to understand a lot, because as you know, I am a kind of workaholic. I work almost all the time. But I think I have a reasonable balance between personal life and work, also because I am accepted as I am. I am a very emotional person, very dedicated to the people, but at the same time, work for me comes first. And everybody who knows me knows this, and if this is accepted, that works.
Okay, very good. And if we could go back, right, and see, well, if I could go back 20 years ago, I would change the way that I did this. I thought about that. Are you regretting anything that you did in the past and you would try to change back to the future? Or?
Yeah, real regrets I don't have. I could have tried to stay where I was, where we were and you also were. I could have tried to be resilient and not move too much as I did. I don't know what could have happened. I have no idea. But that's the only change that could be thinkable, because particularly in a country like Italy, in the academic environment, people don't move much. It's a very static environment. So in that sense, I'm an exception. So I moved a lot in a very static environment. So this could be the thing that may be worth rethinking as a potential different approach to my career. But I have no idea how it would have gone, in that way.
Very good. And you mentioned Professor Fan, Professor Marsden, who have been between the founders of the Movement Disorder Society. What has been the role that this society has played for you?
This is a very active society. It's, I think, has maintained the original spirit of the founders. Of course, it's big, has grown a lot, so there are so many people, so many colleagues, so many interactions, but the quality has remained very high. And this is what we need, a social and scientific environment that maintains its strength and challenging attitude. And this is what it is at the moment still.
Thank you. And do you think that over your career you experience any discrimination, any bias, any barrier which intervene in the development of your career or your even personal life? I think that we can learn, and it can be useful for us to know.
No, I don't think so. I don't think so. I think barriers can be overcome. I don't have in mind any specific barrier for which I think I have been, let's say, victimized or no, I think I had the difficulties that anybody normally has in a career.
So we like your positive attitude, Professor Albanese.
You know me.
So really thank you very much for your contribution and enjoy the rest of the Congress. Thank
Thanks,
you very
Elena.
much, Alberto.